Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are today's reports. Diabetic ketoacidosis, a risk factor in COVID-19 patients. COVID-19 is still a book that needs to be finished. There are a lot of questions that need to be answered with time, and there are a lot of complications as well that are rising each and every day. Diabetes, the most common metabolic disorder, affects the body system generally, and however diabetes mellitus is not a risk for developing COVID-19, diabetes have worse outcomes once infected with COVID-19. A new study in the Diabetes and Metabolic Syndrome journal reported that COVID-19 increased the prevalence of diabetic ketoacidosis with increasing mortality rates secondary to COVID-19 severity, not diabetic ketoacidosis. Therefore, we suggest diabetic ketoacidosis screening in all COVID-19 patients and prioritizing ICU, diabetic ketoacidosis or COVID-19 with low oxygen saturation, blood pressures or even renal insufficiencies. Physical activity to improve diabetes mellitus in older adults. As previously stated, diabetes is identified as one of the 4 priority non-communicable diseases, and it is targeted because of its increasing disease burden. It has been associated with several cardiovascular and kidney and nerve disorders, and according to a study that has been recently published in the Diabetes and Metabolic Syndrome journal, as previously stated, shows that frequent physical activity is associated with the lower risk of developing diabetes in older adults. The results of the study underscore the need to develop strategies of promoting an active lifestyle by maintaining regular physical activity to combat the diabetic epidemic in the older population. Isometric exercise better than HIIT for blood pressure management. Blood pressure is a serious problem worldwide and several medications are in the market to manage it. There are now various restrictions on even the use of these medications to lower the blood pressure, which has led towards gradual rise in the use of non-pharmacological techniques. Isometric exercise training and high-intensity interval training, which is the HIIT, have recently been discovered to be an effective type of exercise that results in considerable blood pressure decrease. The British Journal of Sports Medicine reported that in comparison with the HIIT training, isometric exercise training resulted in higher reductions in resting systolic, diastolic as well as the mean blood pressure. However, the HIIT training, that is the high intensity interval training, on the other hand, dramatically lowered the resting heart rate compared to the isometric exercise training. Significant variability in all the blood pressure outcomes cumulatively for both these training measures hampered the current study. Breakfast consumption with intensive lifestyle intervention tied to greater weight loss in obese. Obesity is a serious problem and its management is also crucial. Obese people are often in the myth that cutting down on one of the meals helps them reducing weight. Breakfast in the morning meals that is advised not to skip with changing lifestyle as well as living habits. People often tend to skip the most important meal of the day, and this habit is trending in the name of brunch. A recent study in the Obesity Journal has revealed that eating breakfast is tied to a greater weight loss during an intensive lifestyle intervention for obese or even overweight people. This was mediated by an increase in the physical activity. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.